Have you ever wondered how to remove tooth plaque at home? Oral hygiene is not just about fresh breath or pearly whites. It's an essential part of overall health, often overlooked. Today, we delve into the world of dental care, focusing on the removal of tooth plaque right from the comfort of your home. A journey towards a brighter, healthier smile and a healthier you. So sit back, relax, and let's uncover the secrets to flawless oral care. Are you ready to take the first step towards a healthier smile? First, let's understand what tooth plaque is and why it's important to remove it. Tooth plaque is a sticky, colorless film of bacteria that constantly forms on our teeth. It's that slimy sensation you feel when you haven't brushed in a while. Plaque develops when foods containing carbohydrates, such as milk, soft drinks, raisins, cakes, or candy, are frequently left on the teeth. Bacteria that live in the mouth thrive on these foods, producing acids as a result. Over time, these acids destroy tooth enamel, resulting in tooth decay. But that's not all. Plaque can also develop on the tooth roots under the gum and cause breakdown of the bones supporting the tooth. If left unchecked, plaque can lead to serious oral health issues like cavities, gum disease, and tooth loss. In fact, the bacteria in plaque are also the main culprits behind bad breath, and if you think that's the end of it, think again. Research has found a link between oral health and systemic health. Conditions such as heart disease and diabetes have been associated with poor oral health, making plaque control not just a matter of a pretty smile, but of overall well-being. Now that you understand why it's so important, let's delve into the methods to remove it effectively. Brushing your teeth properly is the first and most essential step. Now, how do we brush effectively? It's not rocket science, but it does require a bit of technique. First, let's talk about the toothbrush. The right toothbrush can make all the difference. Soft, bristled brushes are best for removing plaque and debris from your teeth and along your gum line. The size and shape of your brush should fit your mouth, allowing you to reach all areas easily. And remember, even the best toothbrush needs to be replaced every 3 to 4 months or sooner if the bristles become frayed. Next up, the brushing technique. Hold your toothbrush at a 45-degree angle to your gums. Using short strokes, move the brush back and forth gently in tooth-wide strokes. Brush the outer surfaces, the inner surfaces, and the chewing surfaces of your teeth. Don't forget to brush your tongue to remove bacteria and keep your breath fresh. Now the star of the show, fluoride toothpaste. Why fluoride? Fluoride is a natural mineral that protects tooth enamel against the acids that cause decay. It also helps to repair tooth enamel that is in the early stages of decay. So always use a toothpaste that contains fluoride. Here's a tip. Don't rinse your mouth immediately after brushing. By not rinsing, you allow the fluoride more time to work its magic. And if you're brushing before bed, consider using a fluoride mouthwash after brushing to give your teeth an extra layer of protection through the night. Finally, timing is key. Brush your teeth for at least 2 minutes to ensure that you've thoroughly cleaned each and every tooth. Use a timer or play a short song to make sure you're spending enough time. Remember, brushing your teeth is not a race. Take your time to do it right. Little patience now can save you a lot of trouble down the line. So, brush wisely and smile brightly. Flossing. It's not just a dance move, it's a crucial part of oral hygiene. Now let's talk about flossing. Yes, it might seem tedious, but it's an essential step in maintaining a healthy mouth. Flossing reaches the nooks and crannies that your toothbrush can't touch. It dislodges trapped food particles and plaque from between your teeth and under your gum line, areas often overlooked in daily oral care. So how do you correctly use dental floss? Well, it's simpler than you might think. First, you'll need about 18 inches of floss. Wind the majority of the floss around each of your middle fingers, leaving about 1 to 2 inches of floss to work with. Hold the floss tightly between your thumbs and index fingers. Use a gentle back and forth motion to guide the floss between your teeth. Don't snap the floss into the gums. That's a common mistake, and it can cause bleeding or discomfort. Once the floss reaches your gum line, curve it into a C shape against one tooth. Slide it into the space between your gum and the tooth until you feel resistance. Hold the floss against the tooth and gently move the floss away from the gum with up and down motions. Repeat this process with the rest of your teeth, and don't forget the back side of your last tooth. A lot of people miss that spot, but it's just as important. Remember, this isn't a race. Take your time to floss properly. It doesn't matter if you floss before or after brushing. What's important is that you do it daily. And if you're having difficulty with flossing, don't worry. There are many other tools available, like pre-threaded flossers, tiny brushes that reach between the teeth, water flossers, and dental picks. Feel free to explore and find what works best for you. Flossing might feel tricky at first, but with practice, it becomes second nature. So keep at it. Your smile will thank you. Rinse and spit, folks. Mouthwash and dental rinses are your next line of defense. Now you might be thinking, isn't brushing and flossing enough? Well, consider mouthwash as the icing on the cake. It's that extra step that can make a big difference in your oral hygiene routine. Mouthwash and dental rinses offer benefits that go beyond just freshening your breath. They can help reach the nooks and crannies that your toothbrush or dental floss might miss, giving you a more thorough clean. But let's get into the specifics. What do mouthwash and dental rinses really do? Firstly, they can help reduce the amount of acid in your mouth. We know that the food we eat and drink can lead to a buildup of acid in the mouth, and this can eventually lead to tooth decay. A good mouthwash can balance out this acid, protecting your teeth from potential harm. Secondly, they can clean hard-to-reach areas. Even with the best brushing and flossing techniques, there are parts of your mouth that are tricky to reach. Mouthwash and dental rinses can get into these areas, helping to remove any lingering plaque or food particles. Thirdly, they can remineralize the teeth. Certain mouthwashes contain ingredients like fluoride, which can help strengthen your teeth and prevent cavities. So, how do you use them? After brushing and flossing, take a small amount of mouthwash, usually around 20 milliliters, swish it around your mouth for about 30 seconds, and then spit it out. Do not swallow it. And remember, don't rinse your mouth with water immediately after using mouthwash. You want to give those ingredients some time to do their magic. In conclusion, incorporating mouthwash and dental rinses into your daily routine can be a game changer in your fight against plaque. They provide a comprehensive clean, balance your mouth's acidity, and offer a protective shield for your teeth. With the right mouthwash, you're not only fighting plaque, but also ensuring that your breath stays fresh. Last but not least, never underestimate the power of regular dental checkups. Dental checkups are more than just a routine or a formal procedure. They're an essential part of maintaining your oral health. These visits to your dentist are about more than just keeping your smile bright and beautiful. They're about ensuring the health of your teeth and gums, and by extension, your overall well-being. Professional cleanings are your secret weapon against plaque. Even with the best at-home oral care routine, there are spots that are hard to reach and clean, and that's where your dentist comes in. Armed with specialized tools and expertise, they can remove plaque that's hardened into tartar, a substance that's impossible to remove with regular brushing or flossing. So book that appointment, sit back in the dental chair, and let the professionals do their magic. Because when it comes to your health, every detail matters. Remember, while these home remedies are effective, there's no substitute for a professional dental cleaning. So there you have it, your guide to removing tooth plaque at home. We've embarked on a journey together, starting with understanding what tooth plaque is, its causes and effects. We then delved into the art of brushing, exploring various techniques to ensure that every nook and cranny of our teeth is clean. We moved on to the significant role of flossing in maintaining oral health, highlighting its effectiveness in reaching places our toothbrushes can't. Our exploration then took us to the world of mouthwashes and dental rinses, their types, and how they add an extra layer of protection against tooth plaque. Last, but certainly not least, we emphasize the importance of regular dental checkups. No matter how diligent we are with our home oral care routine, professionals have the skills and tools to spot and deal with problems we might miss. Take control of your oral health today, and remember, a healthy mouth is a key part of a healthy body.